I'm Dr. John Kadecki. I'm a urologist at UroPartners. I've been practicing urology for 25 years. The bladder is a giant muscle that basically its function is to empty the urine out of your body. So sometimes it's kind of spastic or overactive, and it's a very common problem in men and women of all ages. So we use medications for this, but Botox works by actually kind of temporarily paralyzing those muscles so that they don't contract so much, so that people don't have that overactive bladder and all the symptoms that come from that. There's about at least 7 or 8 different overactive bladder medications. We usually try at least 2. There's 2 different types of classes of medications. So I usually try 1 in each class. And if those work and they're working without side effects and the patient's happy, that's all we need to do. However, if patients have side effects, can't afford the medication, or the medications aren't working, there's other options, and one of those is Botox. Patient comes in, we get them ready, and we go with a small scope through the urethra in men and women into the bladder. And once we get into the bladder with the scope, we use a small needle to inject about in kind of a checkerboard pattern in 15 to 20 places in the bladder. So we paralyze the muscle of the bladder partially. We don't want to totally paralyze it, but we make it so that the bladder is less active, so people have less overactive bladder symptoms. Another option sometimes for overactive bladder, if medications have failed and Botox may have failed, or this can also be done instead of Botox, is something called InterStim. And I call it kind of a pacemaker for the bladder. And this is actually the device that goes in the patient. This is the electrode that goes and stimulates the nerve, and this is a battery basically that operates the electrode. So this is all put in under the skin, kind of in the back of the patient. And then this remote later on is used to operate it outside the body, to change the settings on it. It can be pre-programmed from outside the body. And the nice thing about this procedure is there's kind of a way of test driving it. We can do a temporary one, which involves just a very small electrode and an external battery pack. And we use that to test to see if the procedure is even going to work at all. And that's just an in-office 10-minute procedure. You go home with it for a couple days. If it works, then we take it out, or we take it out either way. And then if you decide to have the permanent procedure, this is done as an outpatient procedure in a surgery center or a hospital. A lot of times people have side effects from the overactive bladder medications, dry mouth and constipation. It can be kind of severe sometimes, and this is a great alternative for that. I'm going to also introduce to you one of my patients who had this InterStim done about 2 or 3 months ago and has had extremely good results with it. And he told me, he said, "Why didn't I tell him about this sooner?" He said he would have done it a long time ago. So we're going to talk to Mel, who is one of my patients, about this procedure.
I was making too many trips to the bathroom during the course of the night and not getting enough rest. That was the first night that I had at least 6 hours of sleep without waking up to go to the bathroom. I can go out and feel comfortable that I'm not going to have an accident. I can do things that I was afraid to do before. I ride the bus. I feel comfortable. It's just a relief to know that you're not going to have to find somewhere to go to the bathroom.